Hello and welcome. I'm Maria Paderon, the Director of Physical Therapy and Rehabilitation Services and the Center for Balance and Hearing at Old Bridge Medical Center and Raritan Bay Medical Center. Hearing loss affects almost a quarter of our population. That includes people of all ages. It is my honor and privilege to introduce our Audiology Supervisor, Dr. Sara Esther Kader. Dr. Kader has been an audiologist for over 25 years, and she has been a great addition to our team. She is highly regarded by many physician and community members for her expertise. Dr. Kader, can you walk us through the process on how to seek an audiologist for any hearing issues?
Thank you, Maria. If you have concerns about your hearing, it's important to see an audiologist and be evaluated. Today, I'll explain the hearing evaluation. I'll also speak about the devices that are available if you do need a hearing aid. Here at the medical center, I first meet with the patient and their caregiver in our audio booth. Bringing along a loved one is important because patients don't always realize that they're missing things, and the people who are around them often notice first. In the booth, we discuss the situations that you're struggling with and your priorities. I ask about the kind of situations where you would like to hear better. What are your listening needs? Different people have different priorities. For some people, it's being able to hear well in meetings. For others, it's hearing well in a restaurant or being able to hear their kids while they're making dinner. A cab driver may want to hear the passengers who are in the back of the car.
What is the next step for any individual who experience this type of situation that you just described?
So the next step is testing your hearing. The test measures how loud sounds have to be for you to hear them. How much are you hearing? We also look for which part of the ear is causing the ear problem. Is it a middle ear problem, an inner ear problem, or is it a brain or processing problem? Determining where the problem is an important part of the testing because it informs treatment. So I'll look in the patient's ear with an otoscope. That's the cone-shaped handheld piece that you often see in your physician's office. Otoscopy checks if there is a wax buildup or any other object that could be affecting hearing and allows the examination of the tympanic membrane, known as the eardrum. Then we do what's called admittance testing. That involves putting a probe that introduces a little bit of pressure into the ear. It feels a little bit like going up in an elevator. And that lets us measure the eardrum movement. We also play some louder sounds to test the reflex in the ear. Next is a test you might remember from elementary school, when you were asked to raise your hand when you hear a beep. We want to measure the softest sounds that we can hear. We also do speech audiometry. This is a set of tests that assess a person's ability to hear and understand speech. This test is important because people may have similar hearing losses, may be able to hear the beeps at the same levels, but one patient will hear and understand speech with great clarity if the words are loud enough, and the other patient will experience distortion even when the speech is loud enough. Differences in clarity of speech are related both to the quality of the functioning hair cells in the inner ear and also to how the brain processes sound.
Can you explain how the hearing loss affect the brain function?
Great question. In fact, brain function and hearing health are more related than people realize. Hearing loss can affect social connections. So if you have hearing loss, you may withdraw from conversations, and that in turn can affect your brain health if your brain is not being stimulated. If you become less socially engaged and more isolated, that can have an impact on your mental well-being. And that's one of the theories why untreated hearing loss affects the progression of dementia. While the why is still debated, the evidence is clear that for patients who treat their hearing loss, the rate of dementia slows.
What do you mean by treating the hearing loss?
Some hearing losses are treated medically, with medications or surgeries. And for that, we refer to otolaryngologists or ENTs. But most hearing losses are treated with hearing aids. When it's time to consider a hearing aid, we discuss with the patient what are their preferences for style, for function, even for color. And that's how we choose what's best for them. Our goal is to regain a fulfilling life with your family, with your colleagues, with your friends.
Thank you, Dr. Kader. That was very informative. Now, what age group of patients do you see at the center?
We see patients from all age groups, from very young infants through older adults.
That's great. It's never been easier to evaluate hearing and vastly improve communication and your day-to-day life, all for just a visit at our center that takes about 90 minutes from start to finish. To our viewers, if you would like to hear more information about having a hearing test and the hearing devices that we offer, please call 732-324-5030. In addition, we also offer comprehensive outpatient rehabilitation services, including physical therapy, occupational therapy, speech therapy, and electrodiagnostic studies for muscle and nerve testing. Please come and visit us, and we would be glad to give you a tour of our facility. We are nearby and we are here to serve you. We look forward to seeing you. Take care, everyone.